Afternoon now. We'll go ahead and get started. And I thank you, Patty, for hitting record. Hi there, I'm Sarah Horst. I am your host for today. And this is the second in our three-part series on authentic leadership in times of change series. Today's topic is the quality improv mindset, and that's improv for healthcare leaders. We do have all lines muted. We encourage everyone to chat in a hello and an introduction in the chat. And for now, we're also going to have cameras turned off. We will have a chance to turn them on for discussion at the end. So with that, we'll get started. And clicker. There we go. So just a brief introduction. I'm Sarah Horst. I'm a team director at ICSI. I've been working there for 5 years, but in healthcare for about 15. I have a master's degree in management. I'm a former professional improv performer, and through our quality improv framework, I've managed to combine my and ICSI's love for evidence-based quality improvement and performance improvement methods with a really great method for teamwork, collaboration, and agility. And so that's, I'm excited to be here today with you. Our objectives today are to appreciate the improvisational nature of your daily work. You are really acting without a script, that you're not unprepared. We're going to describe the 6 guiding principles of quality improv and how to apply them. And then we're going to practice and lead simple improv exercises that foster safe risk-taking, teamwork, and collaboration. What you're going to get today is ICSI's Quality Improv Toolkit. These are the tools that the staff at ICSI use with real groups, with real healthcare professionals on a daily basis. And so we are going to be sharing our secrets, if you will. A little bit about ICSI for those who may not be familiar with it. For over 25 years, 26 years now, ICSI has been influencing healthcare both in our region. We're based out of Minneapolis, so in our region, but also nationally. We provide a collaborative space for our health systems, health plans, and health organizations to come together to solve healthcare's toughest problems. Our work lately is focused on opioids, mental health crises, social determinants of health. One of my roles at ICSI, in addition to facilitating and convening work groups and consulting on quality improvement projects, I do capacity building. One of my, what I do is I look at the healthcare workforce and the people trying to make the changes, and I say, what are the skills and knowledge they need to be more effective? And so often we know what we want to do, but how to get there is more of the challenge. And that how is often dealing with relationships. It's not the technical tools we're lacking. It is the soft skills or the relationship skills, or what I would call the art of improvement. And so because of that, we've developed the quality improv framework as we approach challenges within health systems, and we work with federally qualified health centers, rural, large integrated health systems, health plans. We see some common themes there, and we've identified 3 areas that really need to be activated in order for performance improvement projects to be successful. And what we say is that we need to be looking at our model, our methods, and our mindset. And this is an adaptive approach to classic quality improvement. When we speak about models, we know that there are many really excellent formal models for quality improvement, and I have them listed here. So many of your organizations are steeped in Lean or Six Sigma. You may have the ProSci change management model, Baldrige, human-centered design, Agile. There's myriad different frameworks and models that you can use. And it is really important that organizations have that technical structure as your foundation. But it's not enough. It is not enough to abide by or adhere to a technical framework. Again, we often know what we want to do, but the how is people-oriented. So in addition to that, we look at methods. And these are adaptive methods. We believe that every change maker needs a toolkit of different ways to have conversations, different ways to look at the problem. Those are dependent on the location, the people, and what type of problem you're solving. So none of these are new, but we believe that everyone needs to know how to speak in a way, in appreciative inquiry, motivational interviewing, adaptive leadership, liberating structures, design, coaching. These are the type of methods that you apply to your models. These are the perfect complement to your A3 conversations or your project planning conversations that are very rigid in structure. This is an artful way of approaching those. Our focus today will be on the mindset section. And we've built our mindset section and having an improvisational mindset. So we have the model, we have your structure and your framework. We have some adaptive ways to have the conversation. But then what we need is an overarching approach. How do I approach making change? And some fundamental principles are here. We want to meet people where they are. We want to be highly collaborative. And we also need to be comfortable navigating uncertainty. How often do we say we need somebody who can embrace it or is comfortable with ambiguity, and we all say we are, and then we're actually not, because it's easier said than done. So how to get people into this improvisational mindset is our focus today. And so I want to just give us a little foundation. I'm not going to show a video clip because Zoom has some limitations on videos, but I'd encourage you, Google whose mind is it anyway on, or whose line is it anyway on YouTube, and watch a few minutes of improv after today's presentation if you're not familiar. But classic American improvisational theater is where a group of performers are on stage and they get a suggestion from the audience. And based on that suggestion, they do collaborative storytelling, and it often ends up being quite funny, and we think of it as comedy. And they make the story up right there. They make it up as they go. There's no script. But not having a script doesn't mean they aren't prepared. Now, we often think of improv as comedy. It's funny, I go to the comedy club, or it's people making me laugh. But in fact, American short form improv was not designed as an entertainment tool or comedy. It was actually, there's a number of different origin stories, but I'm going to go to Chicago. And in the 1920s, a social worker named Neva Boyd founded the Recreational Training School. And she used short games to teach problem-solving skills and self-confidence and social skills, where she put people into a spirit of play and a very structured activity. And in the doing, they gained the skills. One of her proteges was Viola Spolin, whose son, Paul Sills, went on to Second City, where many of the Saturday Night Live performers got their start. So one of the most famous improv companies. But before it became comedy, Viola Spolin developed a series of tasks or problem-focused games for children in theater. She was working in the inner city, and you can't just tell people, go up and act. Go up and be funny, go up and do your thing. So again, she put them into their natural learning state, which is for humans, it's play. And that is how she helped people build confidence performing. In the 1950s, a circus performer named Dudley Riggs, who eventually opened Dudley Riggs' Brave New Workshop here in the Twin Cities, which we're very proud of, he was actually doing something called instant theater. It wasn't improv at the time. But the instant theater was, he was a circus performer and he'd be getting heckled by the audience. And rather than getting completely derailed, like, you're heckling me, he's like, well, what do you want me to do? You have something to say, what do you want me to do? And then he'd take it and he'd run with it. And that was improvisation. It was responding to what was in front of you, making something out of nothing and moving forward. So what we're talking about today has its origins in what became performance improv. And we're talking about the field of applied improvisation. And there's many different ways you can apply improvisation. One of the most famous, the Alan Alda School out of Stony Brook, NYU, they teach improvisation to teach scientists to be better communicators. You have these brilliant scientists who can't take their science down to the level that people can understand, so they practice improv. Many of you may be familiar with, out of Northwestern University in the Chicago area, medical improv, which teaches improvisation to clinicians as a way to have really productive conversations. It's about collaboration. It's about role and status and deep listening, and having very meaningful connections with patients that leads to better care. ICSI's field of applied improvisation is improvisation applied very specifically to quality improvement and performance improvement, and the conversations needed to do change management. When you're seeing people on stage trying out things, making things up as they go, what you're actually seeing are a bunch of plan, do, study, act, or PDSA cycles, small iterative tests of change in the moment. And then they adopt, adapt, or abandon right there on the stage. And this is what we should be doing in healthcare. Every time we're testing change, quality improvement is highly improvisational. So let's take a deeper look. I am working on a new certification for quality improvement. And so I'm actually working on the National Association for Healthcare Qualities, one of their certifications, and this is their textbook. And so beyond me just saying PDSAs are improvisational, I want you to take a look at what's in the very first section of this textbook, kind of the be all end all. If you know this textbook, you have the complete package for being a quality improvement professional. And in the very first section, even before they get to statistical analysis or Pareto charts or plan, do, study, act cycles, they talk about leading organizational change. And in this quality improvement textbook, they talk about creativity. And they cite the Center for Creative Leadership's innovation mindset model, where leaders of quality improvement need to have curiosity. They need to be customer-centric, deeply tuned in and dialed in, listening, watching, concentrating on the customer. They need to have affirmative judgment, not be judging, not be shutting things down. They need to be open. And they need a tolerance for ambiguity. They also cite Plesk's creativity principles, where in order to be creative, which is necessary for innovation, we need to have the principles of attention, again, deeply dialed in, watching for those details. Escaping from our rigid mental models, escaping from the status quo, escape to divergent thinking, and then movement, not getting bogged down by barriers or challenges, is being able to continue to move forward. And that is the essence of continuous quality improvement. And so right here in one of the the book on quality improvement, in the first chapter, before the technical stuff, we're talking about the behaviors and attitudes we need to be effective quality improvers. Another source that I really like is Korn Ferry, is a consulting firm that does workforce consulting, and they have a white paper that you can Google, and it's called The Next Generation of Healthcare Leadership, New Demands and the Shift to Value. And what they do is they describe the shift between the fee-for-service workforce and the value-based care workforce, and what qualities make leaders successful in each environment. And it's not to say that a successful fee-for-service leader can't be a successful value-based care or vice versa, but they do point out that there are different qualities that let them be successful in each environment. And so here I have an illustration of successful fee-for-service leaders, and it lists 5 traits, and the bubble represents importance, biggest being most important, smallest being least important. And here you'll see that agility is least important, then presence, then positivity, and most important for a successful fee-for-service leader is striving and agreeableness. Working for the company, following the rules, agreeableness. And so successful fee-for-service managers will trust their current models and skill sets because they work. They will set reasonably lofty goals but stick with familiar solutions. They're going to build systems that emphasize performance metrics, focus on efficiency and systemization, and they prefer organizational roles with stability, and their success is reliant on the established. Now contrast that with what they say are the SuperFactors for a value-based care leader. Smallest, again, being least important, largest being most. And here we have presence and agreeableness as lowest, and the biggest is agility. In the fee-for-service world, agility is the least important. In the value-based care, it is the most. The successful value-based care manager is going to handle uncertain, vague, and contradictory information that prevents a clear understanding or direction. They have a questioning and exploratory approach where they consider a wide range of possibilities and adapt when the first solution doesn't work. And they bring nuanced solutions and more comprehensive solution sets. And they are generally more resilient than the fee-for-service leader. And so what we have is a shift in the tension. We have on one side fee-for-service with structure, familiarity, there's a script. And on the value-based care side, and these are their words, not mine, agility. They like the new and the different. They can team. Team is a verb with others. They improvise. And so as we think, well, I'm going to go back. So as we think of our organizations, we have people who have been very successful in my model for a long time. Do they have the skills they need to be successful in the other? And how are we bridging that gap if they don't? So thinking of your team, who has these skills? Think of someone in your team that I'm describing with that creativity, with that innovation, with that improvisation. Who has those? And how did they get them? Did they learn them in your organization because they were necessary skills to have? Or did they just happen to have them by luck? Or did they learn them somewhere else and bring them in? So at ICSI, we believe in formally training improvisational skills as a way to touch on all of those value-based skills and the creativity and innovation. We believe that improv provides its own framework, and we've called it the quality improv mindset, where when you see people on a stage performing and doing collaborative storytelling, it's not by accident, and they are not unprepared. Why they're able to do that is they follow a certain set of unwritten principles that allow them to collaborate and operate in an environment of psychological safety where they can do safe risk-taking. And those principles are on the screen here, and they're trust. We say trust your partner and yourself. Awareness, tune into what's happening around you. Acceptance, say yes to your circumstances. Movement, say and to continue moving forward. Empowerment, be free to explore ideas and take safe risks. And then commitment, they don't get to stop until the director says they're done. Last month, we did an authentic leadership in times of uncertainty using improv as a foundation. And the concept we talk about there, take those guiding principles just a step further. One of the key principles of improv is you are enough. Is you can get on the stage, stay in your lane and say, I've got this. Even if I've never heard of this, never heard of the suggestion, I'm going to come out, I'm going to be myself. My team knows who I am. They know what skills I have, and I'm going to just be me. And that's enough. And one of the ways we do that is we fire that internal judge that says you're not enough, you're not good enough, you don't have the skills, you don't have the right stuff to do this. In improv, we also talk about playing the scene you're in rather than the one you wish you were in. I can't tell you how many times a suggestion came from the audience. It's like, ugh, bummer. But you say yes and you move it forward. Improvisers tolerate uncertainty. They don't know how it's going to go, and yet they're willing to follow the process and stay in there. They create spaces for things to emerge. There's a saying in improv, bring a brick, not a cathedral, where I don't have to come in and build the whole scene, but I can bring one component, one brick that will be a foundation and that will be a building block, and together we'll create something. And then improvisation is highly reflective, where we do notes. We see what worked, what didn't work. There's an after action review built in there. So that is a review not a review, that's an introduction to improv, and it's very fast. Today is a sampler. Today is just a taste of what this is. And so what I want to spend the next half hour doing is basically giving you ICSI's toolkit. These are tools. So ICSI hosts the neutral collaborative table, or the collaborative table, where health systems and health plans, often competitors, are at the table creating evidence-based solutions, or where there isn't clear evidence, they're creating evidence together. We're an incubator. We are highly collaborative, and we're bringing people who may or may not have any experience working together. They may or may not agree. They're subject matter experts with differing opinions, and we use these tools to help them move forward. We use these tools to set expectations for behavior. We create common context and language so that we have tools to communicate. And these tools also help us foster divergent thinking. And so I actually, your videos are off, so you're very safe. But I'm going to do something with you. I've never tried this on Zoom, but I'm going to do it. I'm going to ask you to stand up. Zoom is just killing me. Today I'm standing up while presenting and it feels really good. I can't tell you, sitting down on Zoom all day is not the best for my energy. And so I would ask that you please stand up. Please do. Humor me. And it's not like, well, I'm working on other emails, Sarah, I'm just listening. Just for this, just like for 1 minute, just stand up. Do this exercise with me. And this is an exercise that I use in long trainings or when I need to shift the energy, and we call it the shakedown. And so I'm going to demonstrate it for you, and I beg you, please do this with me. And Patty, I don't know, can we turn on everybody's camera just for this exercise? And I'm going to ask you to turn on your camera. Put yourself on the view where you can see everybody, Hollywood Squares, and do it. So no, nobody's doing it.
Yes, everyone will have to turn on their own camera, Sarah.
All right. Well, they can turn on their cameras as they go. No takers yet. Well, fearful audience. That's okay. We're going to do
it. Says he cannot start your video because the host has stopped it.
Oh, thank you. Okay. Well, we'll work that out. I'm going to do the exercise. Patty, are you able to turn on videos?
Yes, I will go in and give it a try.
Okay.
Okay.
There we go. All right. The challenges of Zoom. Either way, work with me. We're going to do this. It's called the shakedown, and you're standing up. And what we're going to do is we count backwards from 8. And as we do it, you can see, I can't show you my feet because they're down here, but we're going to say, oh, and I have it backwards because 8, 7, 6, 5, 4, 3, 2, 1, 8, 7, 6, 5, 4, 3, 2, 1, 8, 7, 6, 5, 4, 3, 2, 1, 8, 7, 6, 5, 4, 3, 2, 1. We're going to do our right hand, our left hand, our right foot, and our left foot. And then as we go, we're going to get progressively louder and faster. And so here we go. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 6, 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. 5, 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 4, 4, 3, 2, 1, 4, 3, 2, 1, 4, 3, 2, 1, 4, 3, 2, 1, 3, 2, 1, 3, 2, 1, 3, 2, 1, 3, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 1, 1, 1, 1, 1. All right, there you go. Thank you for doing the Zoom experiment with me. This is an important exercise. Let's see, get to the next slide. I do this as sorbet. And I do this with groups of 1,000. I do this with groups of 10. And yes, I do this with CEOs, with presidents, and with doctors. And nobody doesn't do it. Sometimes it takes a little cajoling, but people will do it. How does your body feel? Do you feel slightly more energized? Do you have a smile on your face? Are you laughing?
Yes.
Yes, thank you. I am often the presenter before lunch. When people have been sitting all day and they're hungry and they're hangry and they're tired, I am sometimes when we do a 4-hour presentation, I will do this in the middle, or I will just do this at the beginning of the meeting to set the tone. I want high energy, I need people to move, and I'm shaking off what they brought in. I have people's attention. A lot of times I have the privilege of going around and talking to a lot of people, and they come up to me during the break and they say, Sarah, you're so brave. I can't even get people, if they come to my meetings, they're all charting the whole time. Nobody's paying attention. I'm like, well, put your sheriff hat on. Make them stand up and do a shakedown. People can't be looking at their phones. They can't be charting. They can't be doing emails. They are paying attention and they're focused. I call this meeting sorbet, and I encourage you to do it. And with all of these activities we're doing today, I encourage you to try them. People will do them. ICSI does this with presidents, CEOs, frontline staff. They'll do it. So hopefully you enjoyed that. It takes 5 minutes. It's fun. It's high energy. And that is a quick improv game that you can bring to shift the energy and bring people into focus and to get started in a way that feels energizing. What I'm going to do next is show you a slide deck. So what we're doing is these are improv tools that you can use practically tomorrow with your staff, with your team, in a presentation, in a staff meeting. You can use these. We do it all the time. I'm going to show you like 5 or 6 slides right now. It's an actual slide deck from a large group meeting ICSI held a couple of years ago. There were 100 people. There were physicians, there were C-suite people, leaders, subject matter experts, and their health systems and plans. The problem we were trying to solve by starting with 10 minutes of improv was we had limited time. We were working on solving some Medicaid problems, not easy stuff. And so we needed people to very quickly get in, be able to collaborate with each other. And being competitors and being people who don't work together on a regular basis, we needed to create some baseline expectations very quickly so that we could hit the ground running. And we also needed to help people break out of entrenched mental models very quickly and give them some context. And so this is the slide I started out with. I said, and I wasn't even the main presenter. You know, they just said, Sarah's got 10 minutes to talk. So I said, we're going to talk about concepts for collaboration. And I said, it's really great to be here today. And we are going to talk about working together because we all have a common goal. We want to get this work done. And we're all here to be productive, to do our best. And we're all starting out with that. And so what we need to do is talk about the sandbox, because we're going to be playing in the sandbox together. And while the sandbox sounds fun and it's a colloquialism, we talk about playing in the sandbox. If we step back and think about it, for those of you that have children or have been around toddlers lately, or think about the sandbox, it's actually not a very collaborative place naturally. Toddlers are very violent creatures. My daughter used to come home with bite marks on her, sand in her hair. They're not you have to tell them to share because they're stealing each other's toys. So what the sandbox actually is, by our human nature, at least the nature we had when we were toddlers, is it's competitive. It's not super open to sharing. It can become violent. So how do we do that? What we do is we teach children and we set the expectations for how we're going to behave. And so today is not an actual sandbox. In many ways it is, though. We have to talk about how we want to collaborate and who we want to be as we work together. What I always do when presenting improv concepts, and this is a side note for you as I'm doing a Train the Trainer, I honor the smart people in the room and I say what I'm providing for you today is food for thought. You are excellent communicators, you are excellent collaborators, you are excellent leaders, and I honor that. And for today, I'd like to give you some additional things to think about as we create context for today. I'm not giving you something you don't understand or know, but I always couch all my improv with, I'm providing you some food for thought. And that allows them to, if they like the concept, to be like, that's helpful. And if they don't, say, well, it was food for thought to move forward. The next slide after the sandbox was I talk about wicked questions and polarities. Wicked questions and polarities are two concepts that are seemingly opposite, or there's a tension that is actually pushing them apart, or we have the perception that they are. And when working with wicked questions or polarities, we have to decide that it is not a false narrative, that both can be true, and we don't have to choose. Now in healthcare, we went through that exercise with the triple aim, where our initial instinct was to say, I can't have high quality and low cost. I can't have low cost and great patient experience. It was these things like, you pick, I'll do one. But we wrestled with the wicked question of how can both be true? During the pandemic right now, we're dealing with how can I work from home and stay connected? How can I have no PPE and still be safe? These are wicked questions. And so I present these things. We're always dealing with polarities, and I put them forward. And what we say is we do an exercise of how can this and this be true simultaneously. And that's what we want to explore today as we're coming together to solve this problem. And you're coming with your perspective and I'm coming with my perspective. And they are true to each of us. And how can we make both true? Or how can we not have to be quickly in a situation of a false narrative? And so what I say is we want to take an improvisational approach. And I go through just a little narrative of what we just discussed earlier of how on stage you get a suggestion from the audience and you do collaborative storytelling. And one of the key fundamentals of this, how they do collaborative storytelling, is they're following a guiding principle that says don't negate or deny your partners. And that saying no stops the flow and stunts ideas. And that we need to see ideas and comments, what people are contributing, as gifts and offerings. And our goal in conversation and collaboration is to honor and to validate. And then we do an activity, and I'll have Jody Dvorkin, our Associate Medical Director, have her camera turned on. She's volunteered to be my helper, my guinea pig today. I lead people through an activity of yes and. Now we had 30 people register today, which is too much for me to put this activity for us. But Jody and I will demonstrate it, just the two of us. This is something that can be done in person in a round table, or it could something that can be done virtually online if you help people understand what order they're going to go into in advance. And what we do is we play an exercise called Yes and it starts with saying, let's have a party, yay! And instead of following the improv principle of yes and, we're going to follow the normal principle that is kind of our gut reaction, our I'm not very good in the sandbox, is we say no but, and then we add our idea. So we hear somebody's idea, I don't agree, I say no, but my idea is better, essentially. And when we're not careful, what happens is we end up being spirit-crushing, soul-killing jerks. We don't mean to be, we just are. And so we're going to practice having a party as spirit-crushing, soul-killing jerks. And so Jody's going to unmute. And I also want Jody, our Associate Medical Director, to do this because she's a doctor, to prove to you that doctors can do this and will do this and can take this seriously. We are going to plan a party, and we are going to decide in advance what we're bringing. I'm going to decide 3 things I'm bringing. I'm bringing guacamole, chips, and a mariachi band. That's what I bring. That's who I am. That's how I roll. Jody's going to decide some things too. In advance, we're bringing those things to the party. And as we're doing our planning, rather than say yes and, we're just saying no but. And we're really going to get into it. We're going to be like, no but, because there's like this universal not face where we can really tell people we're not happy. And so Jody, let's have a party, Muppet Arms. Yay! I'm going to bring guacamole. And Jody's going to say no but.
No, Sarah, but I'd rather bring cookies.
No, but I'm bringing chips.
No, I'm going to bring some soda.
No, but I'm going to bring the mariachi band.
No, I'm going to bring a live DJ.
Okay, thank you, Jody. And that's how we go around the circle. And what we experience as we do that is wah, wah. It sucks the energy, it negates, it denies, it's not super productive. I wasn't listening to her and I wasn't building on her. And so then you move to the optimal yes and. And so Jody and I are not going to think in advance what we're going to bring. Instead, I'll start, and then Jody's going to listen deeply to me and I to her, and based on what the other person says, then we will say yes and add to it. So Jody, let's have a party. Yay! I'm going to bring balloons.
And I'm going to bring glow sticks.
Yes, and I'm going to bring masks because we should be social distancing.
Yes, and I'm going to bring firecrackers.
Yes, and I'm going to bring a fire extinguisher in case it's not safe.
Yes, and I'm going to bring water in case it gets hot.
Yes, and then we can fill the kiddie pool and we're going to have a great time. Thank you, Jody. So that is how the activity goes. And when you do it around the table, it becomes very quickly obvious which is more productive. The yes and people will often describe it as it was more productive, as more tuned in, I was doing better listening. And so what you're doing by doing that activity right at the front, and again, we do this at big meetings, we do this as a foundation, people become hyper aware of the no buts, or where they have the urge to be a spirit crushing, soul killing jerk that they don't mean to be, but they are. You seek opportunities to validate and honor, and ways to also say yes and, or to honor and validate. Even maybe you're like, oh, I don't agree, I don't want to say yes and. Say thank you, say I hear you, or say something also to consider. What your goal here is to move things forward. The result is that participants are able to use this tool immediately in their breakout conversation, and they are starting to show they are able have a way to overtly demonstrate respect and still disagree or add wicked polarity type of ideas there, and let them live and let them be heard, which makes for a richer conversation. They have permission to contribute, and ideas are more freely given. They're not shutting each other down. And so we feel that we do this all the time. We feel it's a really effective way to get there very quickly as groups are in their norming phase. I'll skip that. So that is tool number one, yes and, which is, if that's really the first place many people start with improv tools. Another one is not something I'm going to demonstrate actively, but it is a concept that we find incredibly helpful. And it's the concept of should have said. And in improv, there's a game called Should Have Said, where a performer or performers are on stage and they start talking about something. And the game of it is, at any time, the audience can do a timeout and be like, should have said. And they can just kind of mess with the players. But when they say should have said, the performers are supposed to change what they said, adding clarity, new thinking, or just make a new statement. And so if I were going to play that with my personal life, I'd say, hi, I'm Sarah Horst. I am a team director at ICSI. You say should have said. I say, I am Sarah. I work for an organization founded 25 years ago that does evidence-based problem solving. Should have said. I say, I'm Sarah, and I work for an agency my parents cannot explain even after 5 years. Should have said, should have said, should have said. I restate, I change it, I say it a different way. Now, where this is helpful is when we're, when you want to introduce this is when you're especially developing problem statements. And I'm doing a webinar next month called Simple Tools, where I'm going to do a design exercise where this is especially helpful. I use it especially when jargon rules, when we are just talking the way we always talk and the definition may not be as clear to everyone. And so when you're collaborating with other organizations or other departments who speak different languages, I know I worked for a large integrated health system, and when I said provider, I meant the physician, and when the other people said provider, they meant the clinic. We weren't speaking the same language. And so opportunities to do this where ICSI uses should have said. And so the way you do it is you introduce the concept and you agree that when something needs more clarification, you will in a respectful way say, could we say should have said? I will use this when we say the word population health, social determinants, provider, team-based care, value-based care, design thinking. What do I mean? I do consulting and I'll go in and they'll say population health and I'll say, what do you mean? And then they're like, how are you our consultant? You don't know what that means. I'm like, well, I know about 8 different definitions of that. What do you mean? Could you restate that? Could you be more clear? Could you spell it out? And as ICSI does design work, we as team members will say, could you should have said that? Could we should have said this word for a minute? Could we gain more clarity? It's also great when we are creating solutions and the status quo has become rote. And I call that kind of going through the motion or being zombies. The could we should have said allows for safe clarification, non-confrontation. And it takes the blame and shame out of saying, what do you mean, or I don't understand. And especially in our world of hierarchy, I can't tell you how many times I'm like, oh my gosh, the senior person said that do I dare question? It gives me context of, could we should have said that for a minute to make sure everybody's the same? Is there a different way we could say that? Is there more meaning here? And it'll give you greater depth. And so this is something we use, and I'd love to make it a fun game or gimmick. And I know so often we want improv introduction into our teams to be fun, but we're using this in a really, we're using this as a pretty serious framework to help us do collaboration. So I'd encourage you to test this and try it. Oh, there we go. Now I'm going to ask Jody to do, so that is exercise number 2. Jody and I are going to demonstrate for you one-word story. And what we're going to do, this is improv exercise where you tell a well-known story with each team member contributing just one word at a time. And in order to do this, Jody and I are going to tell and we'll put Jody's camera back on and her microphone back on. We are going to tell the story of Little Red Riding Hood. And just to give a foundation, Little Red Riding Hood is a girl who lives in the forest, and she's going to take some goodies in a basket to her grandma who lives in the forest. And while Little Red Riding Hood's on the way there, a wolf gets involved, eats the grandma. Little Red Riding Hood goes in, gets confused, thinks the wolf's her grandma. The wolf tries to convince her he's not, and she says, "What big eyes you have, what big ears you have," and it becomes all the better to eat you with. That's the general story. So now we're going to tell it one word at a time. I'll start. Jody, once.
Upon
A.
time
There.
was
A.
little
Child.
who
Went.
to friends
House.
to
Get.
a
Basket.
of
Goodies.
that
She.
would
Bring.
to
Mother's. Mother.
to
Make.
up
For.
her
Badness.
when
She.
played
Hooky.
from
School.
yesterday.
So.
She
Went.
to
The.
store
And.
told
The.
manager
That.
she
Needed.
to
Get.
these
Things.
ASAP.
So.
She
Could.
make
The.
behavior
Change.
for
Prosperity. Okay, we'll end there. Thank you, Jody. You're a very good sport. Ideally, this exercise goes on for about 10 minutes, and at some point, the girl may or may not get to grandma's. And so why we do this, it's fun, it's collaborative, it requires deep listening. Those are good things. But what we want to do when we're collaborating, especially when we're doing performance improvement and when we're solving problems that require new solutions, we want to create the space for something to emerge. So often we're driving toward a predetermined solution, and when you really need to listen, when you really need to engage, what we need to do is activate every single person on the team. We know what we're doing. We're trying to tell a story here. How we get there requires everybody's input, and everybody's input sometimes takes the conversation different places. Now, this would have eventually gone there, or it would have been a jolly story and we would have enjoyed it. When to introduce one-word story and why to play it, and this can be done at 10 minutes at the front of meetings. It illustrates how individual contributors are part of the solution. You practice working toward a goal while being unclear how to get there. It creates delight and surprise or frustration in getting to the goal via an unexpected path. Jody did not go down the path I wanted her to. I wanted to be at grandma's now, and she's got me at the grocery store. Jody, don't you know the story? And in my mind, I'm Judgy McJudgerson. You're not going the way I want. And how often are we doing that during quality improvement projects? Like, I went to the conference. I saw what this organization's doing. Let's just do that. Why are you taking me over here? And we can start to see how our instincts are in being on a journey to what we're bringing. And our perspectives is what the right way to do things are. And then it busts hierarchy with all participants being equal. Sometimes I had to say the, a, or the, and I really wanted to say something else and I didn't get to. That a and the and are not sexy words, but they're important. And that no contribution is too small. And what I encourage you to do is play this game for fun. And you can say, I went to a wacky, improv thing. Let's try this. Let's do. You always want to debrief and say, what did you experience? What did we see? What does this tell us about teamwork? And is it a bad thing that you didn't get to grandma's house as fast as you wanted? Or maybe you didn't get there at all when the goal was to tell a story of this girl. And so often we're driving to the goal and we know what, but we don't know how. And we have to allow ourselves when we're creating a space for something more. Now, I'm not talking about compliance. I'm not talking about surgery. I'm talking about when the what is known and the how is negotiable. If it's not negotiable, we shouldn't be improvising. But this is a great exercise to do, and there's a lot to get out of it.
Sarah, can I add one thing?
Please.
So I played this with my kids at home, and actually it was really good in teaching them. They would say a word and then get mad at, the next child for not saying the next word that they wanted to say. Well, I set you up. I said this so you could say this. And it's been a really good exercise to say, you can't tell people what to say or what to think. That's up to them to do what they want to do next, right? And so it's been really good to teach that philosophy of be open to what other people have to say. Don't put in your mind that they have to say what you want them to next. So anyways, I found this a really good exercise and fun with people of all ages.
Indeed, yes, improv with your kids all the time. Yeah, I think that's a really important point. And so often, I know as a leader of change, sometimes I have this instinct to get mad at the people I'm helping change. Like, why won't they just do that or take this vision, or this is what best practice is? And really having the cultural humility to just say, this is where they're taking it right now, and having the curiosity to see where it goes. Now, our job as facilitators is to set some boundaries, but when the what is negotiable, sometimes it's going to meander, but it will get there. And so this is also a great exercise in kind of seeing where those impulses are, and patience. The last exercise I'm going to bring forward is something called mirror. And actually, Jody, I want to have you do this. And I'd encourage you, if you want to follow me, to do this as well. And reflection and mirror, where I usually pair people up in twos. And again, I don't have breakout rooms today, so I apologize about that. You pair up in twos, and it is important, make a note of this. Do not have direct reports, the supervisor and their direct report do this because they just lose their minds. It's so awful for them. But you have two people pair up, face each other, and one person begins by doing a movement and the other follows. And so I'm just gonna demonstrate, if Jody and I are paired up, she's gonna follow my movements. And you do this for a minute, and it will feel like 20, and your people are going to ask if you've lost track of time, and you haven't. So, but have a timer. And after 1 minute, hard with the camera, after 1 minute, you say switch, and the leader becomes the follower, and the follower becomes the leader. And you remind people that payback is not fun. So if you want to be like disco dancing, because I'm like in the 70s now, or Zumba, they're going to do that right back at you. And so there. So Jody, I'll have you stop. Thank you. It's as simple as that. But this is really it's a very quick exercise. You can ask people to do it at the first 5 minutes of a staff meeting. It's good bonding, good fun. Why do we do this? We introduce mirror to highlight the roles and responsibilities of leaders and followers. When I'm a leader, when I was like going like that, it was hard for Jody to follow. So is that me being a great leader? I may think it's hilarious, but how did she feel about that? It helps us examine our comfort, confidence, and connections. Boy, we do not just stare into people's eyes deeply for 1 minute at a time, especially our coworkers. How did that feel? Am I connected? How am I as a follower? As a follower, I really wanted you to feel good, so I'm smiling. You're doing a good job, leader. And as a leader, I'm like, I want to take care of you. Or are we messing with each other? Something powerful in thinking about reflection is remembering that our natural tendency is to match what we see. If any of you have been around a 3 to 6 month old baby, and Jody, your pediatrician, maybe it's 4 months, I don't know, but there's a certain point where the baby will stick their tongue out at you. And isn't it delicious? You just want to like get in there like boo, 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 boo. And what does the baby do right back at you? Boo, 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 boo. They just mirror exactly what you're doing. That is a small, brand new human doing what comes completely naturally to them. They will match what they see. And so I like to do this with groups, and it helps us consider who we are and what we're bringing to the table. What is my energy as a leader doing? Who am I And what people are often shocked to know is I make a living doing teaching and training, getting on stages and flying around, and my trainings are super fun, they're super high energy. And people are shocked to realize I am a raging introvert by nature. That is professional Sarah doing the job. And when I have a 4-hour workshop that I need to get people through, I need to come in with the highest energy in the room. I have a smile on my face the entire time, and we are gonna do this. And you know what my audience members do? They lean forward and go, boo, 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 boo. They are with me because I am demonstrating, I am showing, they are reflecting what I am giving. Now, is this saying everybody should come in and be Susie Sunshine and blah, blah, blah? No. But it is a great reflection in our energy and how we match the culture around us and how we may be able to influence that in both our following and in our leading. And so practicing improv, as I hope I'm illustrating, and not just knowing improv or saying do improv, having a chance to practice it. Think about if you're a soccer player, you know you had to run through cones during practice. Why are you running through cones? There's no cones on a soccer field. You run through cones, you practice the motion so that it's imprinted, it is embedded and hardwired, so that when you run into a person, you remember, I know I have the agility, I know how to do this. So practicing improv in this safe way at 10 minutes before a staff meeting or at the beginning of something or even with yourself in reflection, this helps you practice the behaviors we want to see in teamwork, collaboration, psychological safety, safe risk-taking, agility, and tolerance for uncertain. This is a way to formally practice this. And so today, I wish, boy, I just want to have like 4 hours with you, and we have just an hour that is winding down. Today, I introduced our starter kit and things anyone can do. And I mean this. And so many people are like, oh, this is Sarah. Or, oh, it's personality based. And well, that's great that she does it, but my people wouldn't do it. Everyone at ICSI has done this. My coworkers do this. So there's the shakedown. I may enjoy it more, but everybody does this. Jody's used this. The shakedown, yes and, one-word story, should have said, and reflection. If you can practice these and embed some of these principles in a way that's safe and doesn't feel risky, I would be very interested to see how things change contextually for you. And what I don't want this to be is a novel accident. And what just kills me is the articles in the paper always about some doctor, I took an improv class on my own time, and oh golly, I realized that these skills apply to my work. It's yes. And why are we making this an accident that one person went and found this out? How do we do skills simulation? How do we practice the behavior you'd like to see formally? And don't assume they won't. On the screen, I have actual comments that I get all the time. This is a really tough crowd, Sarah. They won't like this. These are radiologists. These are physicists. They're not into this. Our doctors are really smart, as if I'm used to dealing with dumb people, or that only, not smart people. But it's that fear of don't make me look bad when I bring this concept in. I've had people come to my workshop and say, you're not going to make me cluck like a chicken. And that's a big thing where people hear improv and they're like, so we don't even have to call it improv. And I often get, I didn't want to come to your training, but I'm glad I did. Our former president of ICSI says, Sarah, I just hate this kind of stuff. That slide deck I led with at the front, he literally walked up to me after, he's like, I hate this kind of stuff. I didn't feel great about you doing it, but it was excellent. People will do this and they will get something out of it, whether it's the C-suite, whether it's your doctor, they will do it, and keep it small. So my tips for implementation.
Sarah, can I just say something to that? Because I feel like I've said many of those sentences on that slide, and I can say, Audrey is on the line as well. Audrey and I kind of lead the guideline program at ICSI, so we're very evidence-based, factual, and with our groups, I've said to Sarah, this is not the right people, but we've put in 5 minutes of these things before webinars or meetings, and every time the feedback we get is, that was great, can we have more of that? And I go back to Sarah and I go, oh, Sarah, you were right, it works for everybody. And so I wanted to be on the webinar to say that I have been wrong, because that has always been my thinking. Get to what people want, get to the facts, get to the topic. And people really like these quality improvement, bringing people together, creating relationships. It's really important. So I just can't say I have said all those things on that previous slide, and I was wrong. And so I think it's important for me to kind of share that as my experience. And now I'll say to Sarah, what can I do before a meeting? Give me an idea. I need something to, get people going. So it works then. So, okay. Thanks, Sarah. Sorry to interrupt.
We're improvisers, and I really find that additive. It is so true. This isn't personality based. You don't need me to come in, although I'm happy to come in. We can talk about that. My tip for you would be, don't say we're doing improv. For years, I developed this program 10 years ago, and until about 3 years ago, I called it collaborative communication, because just the mere mention of the word improv sends people running. And I will say, our webinar last week had 170 people attend. This time we only had 30, and I'm convinced it's because we said it was improv, and that's not for me. And so don't declare you're doing improv to people. Keep it small, keep it 5 or 10 minutes, test and learn, adopt, adapt, or abandon. You can say, let's try this, humor me. If it's 5 minutes and say we don't have to do it again, practice, practice, practice. And then the most important thing is you debrief. And this is where the richness is. It's not in the doing, it's in the saying. You just say the words, what did you experience? And then now as a team, you are creating your values around collaboration, and you are making visible some of the behaviors and characteristics that have been invisible, and you're doing it in a safe way. So I'm going to have you chat in the chat, what did you experience today and what feels safe to try? I want to get to some announcements, and then I'm happy to leave the webinar on for some additional time, and we can take the microphones off. But would you chat in, what did you experience today or what feels safe? And I'm going to just promote, this is the second in a 3-part series. Next month, Friday, July 17th, I'm doing my simple tools to reignite the conversation. And this is in the methods section that we talked about. What are the complementary conversation methods that you can use with your A3, depending on your situation? So we're going to talk about design. We're going to talk about adaptive leadership. We're going to talk about liberating structures. And these are, again, tools that ICSI uses all the time. Quick, simple, anyone can do them. And then if you like today's conversation and we're out of time, for ICSI members, if your organization is a member of ICSI, I will be holding office hours next Friday from noon to 1. And that is where we can talk more about what does it look like to implement, or maybe you tried something that didn't work, or hear from other people. So I'm really excited to do this office hours and just continue the conversation. And then also promoting, I'm really, really proud of this work that ICSI is doing in response to COVID-19. We are doing mental health support for the healthcare workforce, and we are creating a collaborative across the country of best practices and promising practices and just novel ideas for how to support our workforce as they're dealing with these unknowns. And so Wednesday the 1st, we're going to hear from Children's Minnesota. They're going to talk about their resiliency rooms that are really heavily used, where people can go and just find peace and calm. And then we're really excited to have a speaker from Johns Hopkins come on Tuesday, July 14th to talk about their peer support program, RISE. So hope you can make it. That is open to anyone. And so in our last moments, questions, comments, you can unmute yourself and you can turn your microphone on. And I'll go back to that. Was this helpful?
Sarah, this is Christian Savig. I just want to make a comment that I put in the chat box.
Hi, Christian.
Hi. So yesterday, I'm a member of Minnesota Change Management Network, and yesterday they had an unconference, and one of the topics we explored was how do we promote collaboration in this virtual world, in this work from home world. And one thing that we talked about was that it's very important that we intentionally build and design energizing activities into our Zoom meetings, particularly if we're trying to do more of those collaborative type meetings. And so what I love is that you provided these very specific examples and you modeled them today, because these are exactly what Minnesota Change Management Network is saying, that we need to be intentional about building into our, really into our repertoire for a virtual collaboration. So thank you for modeling all of this.
It's my pleasure, and I appreciate your reference to change management. And you can call it quality improvement, you can call it performance improvement, but anywhere we're trying to get people to behave differently, do change, we find these activities really, really helpful. Other questions or comments? All right, it is 1 o'clock. Please reach out to us at ICSI.org. Or, whoops, where are we? Here we go. Or reach out to me, shorst@icsi.org. And I hope that I will see you next week at office hours, and you can find the information on our website. But thank you so much for joining us. It's a privilege to work with you, and I look forward to seeing you soon. Be well.